very pleasant afternoon to all of you. I am Dr. Saloni Chadha, an obstetrician and gynecologist working as a senior resident. This day is important to be celebrated. Why? Since the start of time, women were ostracized and considered inferior to men. However, over the years, fortunately, a global movement has achieved significant progress in bringing rights of the women to the forefront. Rapid strides have been made over the centuries to achieve universal suffrage, equal wages, and parity in political and social affairs. And this has made gender equality an achievable reality, but we have not yet reached this milestone, more so in our nation. Feminism is not male-hating. It is in true sense a fight for human rights. Taking a page from my own life, I am a doctor by profession, a gynecologist. Yet, I get called sister, didi far number of times than I get addressed as a doctor because of the ingrained gender bias in global psyche. I do know for a fact that my fellow male doctors have never faced such problems. Even the intern in our ward is called as Doc Saab. I see 100 patients a day on an average, and unfortunately, a handful of patients still come to me pregnant third, fourth, and even fifth time, yearning for a boy. And I wonder why, and I wonder most of all, how their daughters must be treated at home. On this day, I wish there comes a time when we no longer need this day as a reminder that we too are equal. After this food for thought, I would like to steer your attention to my line of work and take this wonderful opportunity provided to me to spread awareness about cervical cancer and breast cancer. After breast cancer, cervical cancer is the second most common cause of cancer among women in India. Every 7 minutes, one Indian woman dies of cervical cancer. Now, what can we do to change this? 1. Spread awareness, and 2. Start screening. Traditionally, screening for cervical cancer starts at the age of 21 years, irrespective of your sexual history, by a simple test called the pap smear. It is to be done every 3 years, and after the age of 30 years, upon adding another simple test called the HPV test, the frequency is reduced to 5 years. No further testing is needed after the age of 65. As to what are the risk factors and causal factors of cervical cancer and what can be done. It is caused by a virus called human papilloma virus, that is HPV, which not only causes cervical cancer but also vulval cancer, genital warts, anal warts, among others. It takes several years for this virus to cause cancer, giving us ample opportunity and time for screening and treating early disease. It is sexually transmitted, yes, and also by intimate skin-to-skin contact. There are 3 types of vaccines available, now called as Cervarix, Gardasil 4 and Gardasil 9. The Indian guidelines advise these vaccines in the age group of 9 to 14 years, that is school-going girls. Though it can be given up to the age of 45, the effectivity would be less. Currently, in India, it is not recommended for the boys, and even after the vaccination, the screening has to be continued. Other risk factors include starting sexual activity before the age of 18, having multiple sexual partners, other STDs like HIV, chlamydia, etc., poor personal hygiene, low socioeconomic status, vitamin A deficiency, smoking, alcohol, drug abuse also contribute. Most of these factors can be countered by bringing behavioral change in individuals and as a society. I would like to emphasize that cervical cancer affects women not just old but also in the age group of 35 to 44 years. That is the prime of their age. Now coming on to the breast cancer, it occurs in women in the age of 30s to 50s. It is the most common cancer among Indian women. Breast cancer is a treatable disease and chances of survival are high if detected early. The only way for this is through awareness and screening. The simplest way is breast self-examination, which should begin by the age of 40 and can be done earlier also and should be done from the age of 30. Breast self-exam is something every woman should do once a month at home. You are to check for lumps and physical changes by standing in front of a mirror and note any redness, puckering, dimpling, nipple retraction, any nipple discharge. Traditionally, it is recommended to have annual breast examination after the age of 40 years and biannual after the age of 55 using clinical breast examination, ultrasound, mammography, MRI. Remember, our goal is early detection. I would like to encourage all of you to seek out to your gynecologists and physicians not just when you are ill, but as a routine for health checkups and to nip the seed of the disease in its incipient stages. Thank you all for your valuable time.